Biggest thing to think about considering all these challenges that both healthcare providers and the patients themselves are dealing with, number one thing we should be thinking about is the patient and what is that patient's experience. And if we invest in the patient experience and if we do more for that patient, then that patient's going to, one, be more satisfied, and two, be more likely to pay. In order to really invest in an individual patient experience, it's really knowing the individual patient, understanding what an individual patient would expect and what makes a good patient experience, not just generally in terms of policy for the facility, but also for the engagement with the patient that you've got in front of you. And so in order to do that, one of the things that you could do is study some of the behavioral tendencies of your historical patient population. Use what you find in that to help predict the behavior and predict the preferences of patients with open account balances or with upcoming procedures. Segment those patients by both their ability to pay and their willingness to pay in order to prioritize the outreach that you're going to have. Prioritize types of conversations you'll have with those patients, taking in consideration not just the broad needs of your patient population, but also the individual needs of a single patient. It goes a long ways towards improving the patient experience, managing their financial obligation, as well as driving more cash in the door and improving patient payments for the facility. Third area to invest in, as we talked about in one of the challenges, is the digital experience for your patients. Part of that is meeting patients where they are and communicating with patients how they want to be communicated with. So have options to be able to communicate balances to patients via text and email. Text is much more likely to be read and opened than even the statement that comes in the mail. On your website, make sure there's options for patients to be able to pay digitally. They can go in, have an option to pay their bill online, be able to take care of it all without necessarily having to talk to a human, be able to do it at a time that's convenient for them and with a method that's convenient for them. When they go and to that website to make their payment, make sure it's not just a dead end. So if a patient comes to a payment portal and sees other options that fit their situation, they'll be able to select from those options and improve the overall experience as well as the patient payments for the facility. So, if there's one thing that makes patients more likely to pay on their healthcare bills, it's really the option to self-serve. Make sure you're understanding each patient's preference for how they want to be communicated with and how they want to receive their bill. But don't just take their word for it. So if a patient says they prefer a paper bill and they prefer to be contacted between the hours of 8 and 5, but your research into your patient behavior tells you different, then still give that patient the option of being able to receive a text if they opt in, or an emailed statement if you know that they would be an adopter of that type of technology. Making those options available can improve the overall patient experience, even for those patients that may have indicated less digital preferences. So although technology is important and it's becoming even more important as consumers become bigger adopters of digital engagement, what it boils down to are the people that are communicating with patients. Because although as a consumer or as a patient, I may prefer to get a text that tells me I owe $800. Probably I'm not going to pay it without talking to somebody about why I owe $800 and what my options are to take care of a balance like that. And so that's why it's important to invest in the people that are having those conversations with your patients when they do need that education and they need those options explained to them. So when you look to invest in the people that are having those conversations, number one, make sure that those patient payment conversations are nearly the exclusive thing that those staff members or that personnel does. It's really important that those representatives understand the U.S. healthcare system. The U.S. healthcare system is, and especially the patient financial experience within the U.S. healthcare system, is a whole different language. And having people that are educated around that are well trained in explaining what goes on in determining somebody's financial responsibility really has a big impact on that patient experience and the collection success. As we talked about, technology is providing that convenience and that digital experience and the options that patients desire. But what it can't replace is the compassion and empathy that a live agent that's there specifically to educate a patient on why they owe what they owe and what their options are, and to be able to do it in an empathetic way makes a big difference in combining that technology experience with the right people to be able to help those patients. So it creates risk for the business itself, where now you've got data that's accessible outside of the country. There are fewer regulations that need to be followed by the representatives that are having these conversations. Having representatives that understand the system and can empathize with patients, that don't create unnecessary frustration just due to miscommunication and don't create unnecessary risk for the business, are really important strategies to making sure that the people are an effective part of the overall patient financial experience conversation. Final piece of the strategy that I wanted to cover today is availability. So you might have heard the old adage that the best ability is availability. In healthcare patient financial services terms, that's being there for your patient, having someone there for that patient to communicate with. So get out of the voicemail trade, find ways to make educated patient financial services reps available outside of standard operating hours when that patient is likely back at work. So have extended business office hours for that patient to be able to call, in the morning before they go to work, or a few hours in the evening. On weekends, when patients are most likely to be available to be able to have those conversations. Have enough coverage that when a representative goes to lunch or is involved in another project, that somebody's there to answer the call, and that patient's not having to deal with voicemail, and that your staff's not having to come in every morning to a laundry list of voicemails that they've got to go through and return. So to sum it up, when you're putting together your strategy to invest in the patient financial experience, number one, put that patient experience first. Everything that you put into it, think about how is this going to impact the patient experience? And then number two, don't think about that patient experience just at a general level, but really take the time to understand your patient population and segment your patient population so you can understand the individual's preferences for a patient experience. Third, make sure you're providing digital options and technology for that patient to add convenience for how that patient is educated and informed, as well as conveniences to how that patient can interact with their bill and actually make those payments and have different payment options. Fourth, balance that convenience with the compassion and empathy of good quality live personnel that can help provide those educational phone calls and enhance that patient experience. And then finally, be available. You meet patients where they are, be available when they're available so that those conversations can happen without frustration of trading voicemails or an inability to communicate.
To learn more about our solutions, visit our links in the description and subscribe to stay up to date with our newest content.